Okay, everyone, we're going to get started. Thank you for being here and thank you for sticking with us for the entire day. Um, we hope that you enjoyed today's breakout sessions and are walking away inspired, energized, and ready to take action. Now, for our closing keynote, this session will explore how community-driven insights are reshaping healthcare, influencing policies, and empowering grassroots efforts to address the most pressing challenges across California. I will briefly name off the different people joining me up here, some big cred. So we have Dr. Cecia Aquino from she's executive director at Latino Coalition for a Healthy California. We have Virginia Hendrick, executive director at the California Consortium for Urban Indian Health. We have Dr. Tu Quach, president at Asian Health Services. And we have Danny Cesena, right? Did I get that right? Director at California LGBT Health and Human Services Network. Um, you know, as I was thinking about how to open this panel, I was mentioning to them, I thought of the movie, and and here is my interpretation. Data is everything, everywhere, all at once. Um, and we know that we live in a world where data on us is collected in the background, whether it's through our phones, our watches, our televisions, our computers, our cars. It's everywhere. And data collection is happening around us. And when we are able to retrieve some of that data, it could be overwhelming to make sense of it. And we also have to see data as a tool. And it could be manipulated for good or for bad. And in my career of over 20 years, a lot has changed, especially with the implementation of the Affordable Care Act, where FQACs were able to plug into electronic health records. I remember early in my career where I would walk into a clinic and there'd be a whole room full of files. And the way that people did population health management strategies was pooling a few of those files and see like what you could take away from that. And now today, a lot of that data is digitalized. And I would say that in terms of analyzing that data, just the sheer amount of it, there is a lot to learn, and there's still a far way, we're still away from being able to get meaningful data, at a meta level. And so I'm excited for this conversation today because as we talked about earlier in the sessions, the voices of our communities and the stories that we tell using data are important. I know that Attorney General Bonta earlier talked about the legal fights. I think there's also political fights, but there's also narrative fights. And so as we think about data and what we want to lift up, I am hoping that we will be inspired by this panel today. I know I'm excited about it. So let me start off with the most basic question. What is data and why is it important? Danny, we'll start with you.
Sure. So data is exactly what you said earlier. We're constantly being monitored, whether by our Apple Watch, our iPhone, and such. But really, the way I utilize data is community healthcare disparities. Really understanding what is it that the LGBTQ community is experiencing in terms of accessing healthcare, barriers to healthcare, and anything that even goes along with mental health care. But on top of that, even looking at the intersectional identity of the person, because we're not just LGBTQ, we're also African American Black, I'm Latina, and Native American as well. I'm also a person living with disabilities. I live in a low socioeconomic neighborhood. So how does all of that factor into my health, and how does all of that factor into the data I collect to be able to analyze it and write a policy platform to address these disparities?
Great, thank you. And that's the difficult part of just choosing one box, right? Because we're much more than one box. Virginia, do you want to add in?
Yeah, thank you. Ayukui Nakna, Virginia Hedrick, Shregon Mewamechuk. Good afternoon, my name is Virginia. I'm a member of the Yurok tribe and live and work here in Nisenan territory in what is now Sacramento, Carmichael. I think we have to think about data at its historical roots. For American Indian and Alaska Native people, we did not gain citizenship till just 100 years ago. So in 2024, we gained citizenship, which means census records before that did not count American Indian and Alaska Native as citizens or as people. You have to think about the history of California. We were more than 50 years into statehood, and the indigenous peoples from this state were not being counted. There was a point in the census history where African American people were counted as 3/5 a person and counted only to accumulate power for white people. Voting power for white people. So, and I say that not to make anyone uncomfortable, but if it does, that's okay. We can all wiggle a little bit. But we should be a little bit uncomfortable with the racist roots of data, how it has been used against our communities, and how we have to take it back. And we have to own that narrative. So when we started this conversation, I was like, whoa, before we get too far, we have to remind everybody that data can be racist. And how do we move mechanisms to make it anti-racist?
Great. Two or Cecilia?
I would love to add, and thank you for talking about that. Muy buenas tardes, Ceci Aquino. It's a pleasure to be here today. I think we have to acknowledge the time that we're in, right? And data to a room like ours, right? When all of us are data nerds, policy wonks, we get excited about the numbers. But what does data mean outside in the general public? And I want to make that connection to power that you mentioned. Data is justice. It is a tool that we can use to advance justice. It matters who is analyzing that data, who and how the data is being collected, and what kind of stories and narrative are we creating with the use of that data. And so for many years, data has been kept at that academic level, right? We have folks telling our stories, talking about our people, our disparities, and many times our communities and our community stories were left behind. And so we didn't get a full picture. So when folks were designing policy solutions or looking for solutions for any one problem, there was a key component that was missing, and that was community wisdom, people power, and the knowledge that our folks hold from that lived experience. And so I know for all of us here, that is key, right? Not just digging into the numbers and just quantitative data, but looking at qualitative data as well.
So I wanted to start off by saying Chúc mừng năm mới, which is Happy Lunar New Year in Vietnamese. As a Vietnamese refugee working at Asian Health Services and FQHC serving 50,000 patients, many of our patients are immigrants and refugees from Asian countries, as well as we serve some Pacific Islanders. The data piece, I agree with everything that's being said. For our communities, the lack of data disaggregation has done so much injustice to our communities. Some of you have already heard the term model minority myth, where many Asian Americans are seen as not struggling with health disparities, not facing a lot of the inequities that other communities of colors face, and which is wrong. And a lot of that is because our data is just really aggregated together, not just for Asian Americans, but Native Hawaiians and Pacific Islanders who have such a different history from us, such different lived experiences. And we've been fighting this for so many, centuries even, the fact that our communities are so diverse. And when data is aggregated, a lot of hidden disparities are kept hidden. And then that narrative that we don't face, we don't face health issues, but we're actually used as a wedge against other communities. Like, hey, Asians can do it, why can't you? They're doing fine. And it's so not true. And as someone who is a refugee from Vietnam who came here because of what happened in the Vietnam War, like I can tell you the struggles that we've gone through and many of the Southeast Asians have gone through that often do not show up because data does not get disaggregated. And I'm sure we're going to get into data disaggregation in a bit, but data is so much power, but it's also used as a tool to keep many of us down.
That's what I said at the beginning too, right? It could be used for good or bad. And, you know, I think colonialism also just plays a role in, you know, what data we have left over. Right now, we see the movement of getting rid of books. And what does that mean? And changing history books. I didn't even know you could do that, but apparently you can. But yeah, all of this is so important and timely. Virginia, I'm going to ask the next question to you. In what ways has data been weaponized against the communities you serve, and how can we protect our communities from the misuse of their data?
Yeah, a good friend and colleague of mine, Abigail Echohawk, has coined the term data genocide. And so as American Indian people, we've experienced waves of genocide in what is now the United States and in California. And now we continue to experience genocide as it relates to data. So often what we'll see, and it was referenced earlier in a side conversation, the California Health Interview Survey is a really great example. If you're looking for health disparities as it relates to American Indian people, it'll often give you a little asterisk. And sometimes Indian country is referred to as the asterisk nation. There's a little asterisk that says, not enough data available here, data unstable. So folks are really comfortable with saying, okay, print, we just don't know enough about it. And we shouldn't be. We really need to pause and say, well, what is the data saying about this? What's happening? We do know that American Indian people exist and that they do have health issues. So what happens if we pool a number of years of data together? Can we get a sample size large enough to say something significant then? And oftentimes that's one solution. I think in the introduction earlier, we are multifaceted people. I am an American Indian woman born on reservation on the Klamath River, which is now a free-flowing river for the first time in 100 years. Yeah, it's exciting. Yeah, we got good news, right? The Klamath River dams got blown up. One of my kids asked me, like, how did they take them down? And I was like, they blew them up. Like, literally put TNT in the dams and blew it up. So we can blow it up, right? Like, we can blow up systems and we can undo them. What I was saying about my introduction is I'm also the daughter to a white woman. And that characteristic is not who enters the room. That's not how people recognize me. And yet, that exists. I am also part white. So if I complete a data survey and I say American Indian and white, then I'm going to be more than one race. I'm going to be multiracial. That's where my data will go, despite my lived experience, despite our intersectional identities. And so sometimes the proper data protocol is, let's disaggregate it a little bit. What's really happening here? What happens when we say American Indian, Alaska Native alone and in combination with another race? What happens if we recognize historical, legal raping of American Indian people in California and we allow people to be multiracial? Then what does the data say? So those are some examples, I think, of ways that we've been harmed. We saw it in COVID when folks were originally saying, there aren't really American Indian people dying in California of COVID, it's not happening. And then when we controlled for some of these things, we found that actually American Indian, Alaska Native people were dying of COVID 3.5 times that of non-Hispanic whites. So it exists, we just have to do the extra work.
Thank you. Does anyone else want to tackle that question?
Maybe I'll just add in terms of outcomes, right? So when we don't see the right data and the right points that we need to see about health outcomes, about the way our communities are experiencing the systems that we're in, and we're privileged to live in California and to have that power to fight for access, but many times we're still missing key data points. And I'll speak for the Latinx community. We're not a monolith, and many times our indigenous communities get lost in the data because we're labeling everybody as Latino. And those intersectional identities get lost, and specifically for our indigenous communities, it is extremely hard. Many times in our spaces, we talk about access to Spanish, making sure we're getting information out to the community. But we don't talk about indigenous languages, Ganjobal, others, right? And we have indigenous community members all across California who are not able to understand the information we're sharing with them in Spanish or in English. And so then our community members have to do that work of connecting folks. But if we did have disaggregated data and we were aware of how and where communities were accessing, we could be a lot more intentional about resource allocation. And you'll hear a little bit later about the data disaggregation bills that our communities have been fighting for, but that is a big part of it. Just understanding how our different community members and how that diversity within the Latinx community for us is experiencing our different systems.
Great points. And to add to that, I had an experience when I worked at a county, and we were looking at our electronic health records, and we were trying to figure out, what percentage of our patients were identified as gay, lesbian, and then a separate looking at gender identity. And we had the ability to hit a switch and collect it, but we didn't. And so we started asking the question, why are we not collecting this? And they said, because if they answer something, we don't know what to do, right? They didn't have the resources. So that to us was a signal of, we need training. We need to demonstrate to you, once you collect that information, you have a broader picture of this patient. And you're right, we need to give you constant training on how to approach these conversations. And so this next question is for you too. Tell us a bit about how your organization leverages data to empower communities.
So at Asian Health Services, we actually just turned 50. We had a gala just this Saturday, and I needed it because we got to see like the 50 years of how Asian Health Service was built when they didn't really believe that our communities needed healthcare. They're like, they're fine. And most of the time we weren't showing up because no one spoke the languages our communities needed. So that lack of utilization was just more reason why we didn't need something. And it was really painful. So at Asian Health Services, since we started, we have always collected important data that our providers are using, including ethnicity, including language, because we actually utilize those data to be responsive. And so we're very proud to always provide culturally and linguistically responsive care, hiring folks from the community, hiring providers that speak the language and come from those communities, and really understanding what our patients face. And so now that we're on electronic health records, we're able to look at our data and say, hey, we're providing these individual care, but let's look at it and disaggregate. Let's do equity analytics where we're breaking it down by ethnicity. We're doing really well, but are we doing really well across every single group? Are we doing really well with the Cambodian patients, just as we're doing as well with our Cantonese-speaking patients who make up the vast majority? And oftentimes we find that the smaller communities don't fare as well. And even though we started to serve the AA and HPI, we don't turn anyone away. So we have some Black patients, we have some Latinx patients, and we look at that and say, hey, is there something that we're doing where they're not doing as well? And then we try to look deeper and try to respond. And so during COVID, we saw, when we're looking at who's getting vaccinated, is the percentage high across? So in a way, it's really empowering us and making us accountable to the communities that we arose from, and being able to use that. But I wanted to share a story of what, as we work through with the state and with many of the governmental agencies, what happened. So, I think in 2023, there was an RFP released by the California Department of Public Health, and it was actually on youth suicide. And we found out that Asian Americans and Pacific Islanders were not among the priority populations. And we're like, what? Like, why would you not include us? Our youth are suffering. There's so much suicide. We're hearing it from the community. And they're like, well, the data just doesn't show it, right? And there is another form in which our communities have been, excluded. and again, othered in all of this. And then, we came forth and showed data that shows otherwise, that actually when you broke it down, the Southeast Asians and Pacific Islanders had really higher suicide rates. Those who are identified as multiracial or multi-ethnic are really high. But it's really, again, that response of saying, hey, that's not the data we're using. So after some work with the California Department of Public Health, they have been listening to their credit. So we had to bring the data to them and show them, like, this is how you should be looking at the data, not really aggregating and then leaving us out of these important tables where we need those kinds of resources. But again, I have to say, it takes a lot of work, and it's really tiring to ask again and bring your own data to demonstrate why you should be at the table, and then sit at the table and then do that hard work. So I want to say that that's always been the struggle that our communities face around data.
Great. Does anyone else?
Yeah, I mean, I agree with you 100%. Same thing with the LGBTQ community with collecting SOGI data, especially in the times of COVID. County health departments were supposed to collect SOGI data for anyone that was getting vaccinated. And when we went to go look for that data, it did not exist. And one of the biggest things that we heard from county health departments, which was like what you experienced, was we do not know how to collect the data. We feel uncomfortable collecting it. And what that is, without even realizing it, is folks being compliant with the erasure of LGBTQ communities and data collection. So when we cannot find our data like we should be able to in state systems and such, we're doing the same thing. We're sending out surveys to collect our own data to identify who's received a COVID vaccine, who's consistently going back every year like the way we should be doing, and presenting our own research that the state should be doing, that the state should be engaging in, that the county health departments and electronic medical records as well. And that's data that's not there, and we're constantly pulling. We're not just proving we need a seat at the table, we're pulling up our own chair to the table. And we're doing exactly what I'm gonna steal from you, making people wiggle with uncomfortableness, because people aren't gonna listen to us because the technical data isn't there, and this is community-led research data, which is just as valid as academic data.
Bravo. On that point, on community data, so at LCHC, we lead a listening tour across California. We cover 8 different regions in Spanish, English, Spanglish, and Conjoval. And we're able to gather data from key promotoras, from community leaders, right, about the difficulties and the different barriers that they face. And we approach the work from a social determinants of health perspective. So not just the healthcare delivery system, but also other systems that touch on our health, talk about food stamps, green spaces, safety in their areas. And we're able to look at that community data, right? The different quotes that are really powerful, many times heartbreaking stories about community members, right? That sometimes get lost in the translation of looking at a percentage of people that are utilizing care or accessing care, right? But we're able to combine that with quantitative data. So then we look at the ACS and we look at the regional breakdown of county rankings and what that health access looks like in their region. And then we utilize that in partnership with our qualitative data to tell that story. And we're able to translate that into the one-pagers that then we share with our legislative partners, other folks in the community who are able to use that as a tool to walk into any meeting with the evidence pointing at the different needs and the possible solutions to address health equity.
Great, thank you. So insightful. Cecia, we'll start with you with this question. And I think we started to address it already, but what is missing from health data we have access to today, and how can we partner with the state of California to improve it?
Thank you for that question. And I look at you because this has been a beautiful work of partnership and learning from each other and practicing what we're talking about, right? Lifting each other up, lifting our communities together. So in the past 2 years, we had our bill, SB 1016, which look at data disaggregation for Latinx communities. Last year, I'm happy to report that the governor signed it into law. So, big clap.
Woo! There's more coffee. We want to hear you.
But it was quite an achievement because it is historic in nature, given that it's one of the first bills in which we were centering indigenous communities. So we were asking for that data disaggregation for all of our Latina community, breaking it down by country of origin, if you were from Guatemala, Mexico, but also indigenous communities, Mayan, Aztec, where were our community members coming from and what were they reporting? When we first set out to look at that data disaggregation, we were looking at all the different departments, right? Making sure that we were including data sets that we knew would be important to tell those stories in terms of access. However, as we know, it's always a conversation around the budget and what can be achievable in a certain year, right? So those different departments got narrowed down to just the Department of Public Health, and working with the department to really help us write a report, do the data disaggregation at that level, in terms of not just country of origin, but also languages, which is really important because for many folks, they can be from a similar area or region, but they speak a different language, especially with indigenous languages. So it was really important for us to narrow that down. We were able to partner with amazing indigenous community leaders, CBDIO, Cielo, MICOP, to do that work in partnership, right? And from that people power perspective. But I mentioned you because a lot of this work really came from learning about AB 1726 and the great work that was done there for the AAPI community. And so when we look at pursuing justice for one community, we're not limiting the pursuit of justice for other communities. We're just saying, at this point, we need to be intentional for this community, but come up with me. Let's pull up another chair, to your point, right, to now pursue justice for you. And I think in the time that we're in, that's the kind of fight that we're in, that all of us here in our heart believe in justice, and we're practicing that in our day-to-day jobs. But this is the time to share resources. This is the time to unite hands and say, regardless of what is coming against us, we can fight. We are stronger together.
I love that. Yeah, give her a hand. That was great. Who knew that talking about data could be emotional and and driving the heart? Chu, do you want to add to that? Because I know you worked on AB 1726.
Yeah, I just want to say congratulations. We were so excited when SB 1016 passed. I think we recognize that disaggregation is foundational to equity, and I'm going to say the word equity and not be afraid of it. We know that it's key. So we mentioned AB 1726, but actually AB 1088 that was passed in 2011 started requiring disaggregation for Asian Americans, Native Hawaiians, and Pacific Islander communities. And then Rob Bonta, when he was assembly member, passed AB 1726 in 2016, which expanded that and required it for the California Department of Public Health. I wanted to note that it was supposed to be implemented in 2022, July 1st, 2022. We are still working at it. All to say that even when great policies pass, the implementation is often some of the hardest work that we face. And so I wanted to tell a story. We've been pushing, and I feel like, I want to say that the California Department of Public Health has really been trying. You know, they put out a report showing disaggregated data, and most of it was like, well, you know what, it's missing. Providers aren't sharing that data, they're not collecting it. And you know, as a provider, we're like, huh, that's interesting. Like, I know it's partially true, but I don't think it's the only truth. And so a group of us, you know, Asian Health Services started this statewide coalition, Health Equity Coalition, with different partners across the state serving AA and HPI, and one of our big areas was data disaggregation. So after a lot of work, we got the CDPH to have monthly meetings with us as part of a data disaggregation work group, along with many others. And so it's been great. And so you have really motivated individuals sitting at the table. And we're looking at the data, and we're saying, hey, you know, while we are requiring this, a lot of it is making sure providers are collecting it and making sure communities are giving it. And so I said, well, yeah, all this is true, but should we kind of work it through the whole data pathway? Because I don't think they're the only groups that are bottlenecks here. Let's really identify that. And so I had someone working on the care data on vaccine registry. And I remember him contacting me going, hey, do you want to work with me? I'm looking at your data for Asian Health Services, and I'm surprised that you guys aren't sending disaggregated data. And I was like, yeah, we would send it. We're one of the poster child for this. We collect it. And so I talked to our staff, and I'm like, what's going on? And I'm not going to name any like actual names, but after back and forth, we found out as our EHR vendors send our data directly to CARE. And so it gets pulled, and so we're not touching it. They're just pulling that. And we found out that when they were sending it on, they were re-aggregating into racial ethnic groups. And so we're like, no, AB 1726 passed. You know, their CARE is able to receive this data in a disaggregated form. You should make sure you send it on. And then they were like, well, we never got any notices. So then we went back to CARE and said, hey, are you letting the vendors know that they should be sending data this way? And they're like, yeah, we haven't published that yet. And we're like, wait, here's the bottleneck. Let's not just point to the community. Let's not just point to the provider. Let's walk through so we can really understand what's going on there. And that's a good example where, you know, I think CARE was ready. They set it up. They put a lot of work to set up the infrastructure. We were all putting it in the way we should, but somehow there was this lack of communication. And so we've now been able to say, hey, that's one data system, but we have to go through every single data system. Unfortunately, it's not all that coordinated. Everything is its own system. So we have to walk through that whole data pathway to understand the bottlenecks, to really get at what our measure of success is, that it's disaggregated data that gets reported back to our community so that we can use it to empower our issues. But there's a lot of work that needs to be done in there.
Thank you. I know we still have a few questions left, and we should try to get through them so we could have the audience ask questions as well. So this next one is around data is a powerful tool, not only to change minds, but also change hearts. How do you leverage narrative and community voices to educate policymakers?
You know, it's a really great question, and I don't think that question could be answered without acknowledging the fact that the federal government has erased data. CDC data no longer exists. NIH data no longer exists, unless, you know, we're able to find it through an underground, you know, website link and pull it and save it in our own files. And that's literally what data analysts have been doing for the past several weeks, if not months. So right now, let's call it what it is. The government is erasing communities of color. They're erasing all of us up here. They're especially erasing LGBTQ communities, mainly transgender communities. They're coming after me personally as a transgender person of color. They're erasing us. And because of that, communities are terrified. They see what it is. And they are very hesitant right now to provide their data. Their SOGI data, their racial demographic data, age, race, you know, socioeconomic status, because what if the government can find them? What if they're turned into ICE, you know? So what are we doing as leaders to educate the community, to let them know, hey, it's still safe to work with us. It's still safe to work with the state of California and provide this data. How are we educating them on how we implement de-identifiers? How are we educating them on ensuring that, like, hey, this is not going out to anybody, and this is how we're actually going to use your data? And are we partnering with their trusted community centers? These folks, go to their local community centers, the Boys and Girls Club, the LGBTQ centers. They go to different organizations to receive resources and social services. Are we working with them to not only educate the community, but to engage these CBOs in the research to show like, hey, even your community org trusts us because they know we're gonna do right by you and we're gonna collect the qualitative and quantitative data and tell your stories in an authentic way. And once that data is collected, both qualitative and quantitative, making sure we take it back to the community and do a gallery walk. Hey, based off of your responses, this is what we found. This is what we see. And these are the quotes we want to pull from your stories. Is there anything here that you're seeing that we're not? Because I'll be honest, as a public health professional, I have horse blinders on and I'll see what I want to see. And getting that community perspective and getting their vision of like, hey, you missed X, Y, Z, and have you thought about this policy? It's like, oh my gosh, thank you so much. I didn't even see that. And then even as I'm drafting, the policy recommendations, taking it back again, hey, this is what I wrote, and this is what I'm recommending based off of everything. The community needs to be a part of each and every step of the way, especially right now with what's going on nationally. I know we're in here, going through 2 weeks of trauma, and I want to recognize that trauma. But our community is going through it even more because they're looking to us for the answers. They're looking to us for the safety. So we need to make sure that everything that we do when it comes to research and data, we're not unintentionally erasing anyone, and we're making sure that community is a part of each part of this process.
Great, thank you. Virginia, we haven't heard from you. I would love
Yeah,
see
I mean,
what-
I think data is its own storyteller, right? It tells one story. And I think the story you shared earlier is such a beautiful example of that. You can look at something and say, oh, this is exactly how it is. We see no one's submitting the data. The data tells the truth. It's the one truth. And we live in a Western colonial society that takes those numbers as matter of fact, right? It's a matter of fact. This is what the data says. But many of us from indigenous communities don't take anything in black and white as a matter of fact. And we don't take anything from the federal government as a matter of fact, right? We're talking about a community who has historically been lied to by this government over many administrations on every side, right? So it's not a matter of fact. And the question is where does the narrative play in? It's all about the narrative. It's all about the community saying, that's not my story. If you look at American Indian Alaska Native people, there's a story that says that we have the highest rates of substance abuse, the highest rates of youth suicide, most likely to die in a car accident under the age of 45. That's a story I was told my entire life. I think I was surprised to live to the age of 35 because I thought I'd probably die in a car accident before that. But the facts are there are many stories. American Indian Alaska Native people also have the highest rate of abstinence, of not using any substance among all races. That's a different story. We don't talk about that a lot because it's not as sexy, right, to talk about some of the strength-based stories in our communities. American Indian women have the highest rates of exclusive breastfeeding. We also have the highest rates of sudden infant death syndrome next to African American women, and any given year we change back and forth as a race nobody wants to be in. But so that's the power of narrative is what are the facts? What are we really looking at? What do we want to say? What's important to say? And pushing back. I think pushing back on what's there, what's not there, and what needs to be there.
Beautifully said. And we've already started this piece of the conversation, basically this entire conference. As we enter into 2025, and I have to say, it was the longest January ever of my life. We're already seeing the anti-immigrant rhetoric from the administration, starting with identifying undocumented immigrants in all social settings, potentially including clinics and schools. How do we maintain the trust of the communities we serve? And anyone could start.
I can jump in. You're right. It has been a very heavy start to the year. I'll speak from a personal experience. We talk about community all day long, but my own family has been facing this at a very personal level We're seeing our parents, our tios, leaving their workplaces because they're afraid they're going to get picked up by ICE. They're not going to the store. They're not walking their dogs anymore because they're afraid to leave their home. And, you know, just thinking back a couple of years ago to the quarantine with COVID-19, this pandemic that we together, all of us went through, right? And now here's a different type of pandemic, what I'm calling a fear pandemic, because it's pushing our families and our community members to stay indoors, to be afraid. And now more than ever, that narrative piece needs to be stronger, more powerful. We need to focus the stories that we're telling from a powerful perspective, from the power of community, because all day long they are hearing a negative rhetoric about themselves. And unfortunate, we start to believe it just the way you shared, right? So this is our job to tell a different story, to shed light on a different side of facts, on the different data points that our community needs to hear. And so how do we gain or continue to keep that trust in community? We need to communicate the facts, right? We need to be very aware that we can no longer just throw out blanket statements, right? Because that's not the reality. But we need to empower folks with the knowledge that they need about the systems that they might need to access in times of acute needs or treating chronic disease, whatever it is, in a way that they feel responsible and that they have ownership about the decisions that they have to make it into that clinic, to overpower their fear of showing up at their appointment, right? Know your rights, especially in the healthcare delivery system, are going to be extremely needed. So I would encourage folks that are sitting here today from clinics or healthcare delivery systems to really think about how you're communicating with your patients, in what language, through what systems. Are you utilizing trusted networks, right? This is the time to tap into promotores. This is the time to tap into community leaders who have that knowledge of what to say, how to say it, how to communicate in a way that doesn't amplify that fear-mongering, but actually provides the necessary tools and the necessary data that folks need to then make decisions.
Yeah, I have so much to say about this, and I probably should keep it short. So the past 3 weeks, we've been spending so much of our time designing Know Your Rights training, not for community members, but for our clinic staff, because we expect that ICE can show up at any period. And what I mean when we say we train our staff is, what do you do? What do you say? How do you read to know what is a judicial warrant? And our staff are doing drills, they're doing everything because they really believe in making sure that their communities feel safe when they show up. And we know the chilling effects of using healthcare is going to be big. But as we were doing that, I started thinking, what about our data? There is going to be major chilling effects of giving disaggregated data, of giving SOGI data, of giving ethnic language data. And are we really up to the test to really protect that data like we said we would? We're asking them to put their trust in us, and we still need that. That movement for data disaggregation to get to equity is a road we don't want to abandon at this point. Because once we abandon it, I don't think we can get back on it. But are we doing everything we can to ensure that that data is protected? And I'm not sure we've had enough of this discussion. We looked at our data and we're very honest. We said, hey, there's a field for immigration status. And we've already told our staff, do not collect that. That's been an ongoing thing. And we thought, okay, that's good, we're okay. And then I started hearing well, what about in the notes? And I'm like, in the notes? And people are writing notes because they need all of this information. So we need to think about how are we training our staff on how we document that they're trying to do what they can to help that client. and it could be used against them, especially in the age of AI, where they can run through the data. And even as we are sharing within our county, as we are sharing data through the data exchange framework, which I totally believe in, they are just more points of vulnerability that we need to put in. So I say that to say I don't have a good answer, but in the same way that we are really, really forceful in making sure that our staff are trained up on know your rights, I think we need that same discipline when it comes to data. And not to think that, hey, it's California, it'll be okay. I do believe that California will do everything it can. But we are facing something that we've never seen before. So anytime that data goes out of our hands, that is another point of exposure, another point of vulnerability. So I think we need to invest in how is it that we could train up staff to document, to collect data in a way that's safe, and looking at every way in which our data is traveling somewhere else that could be used to harm our communities, because that's exactly what could happen.
Yeah, that's real. That's real. You know, I have the last question, and Virginia, I'm going to ask you to kick us off or to answer it, which is, what is one thing, we'll start with you and then we'll go down the lane, and if we could be concise so we could have at least one question. But what is one thing our audience can start doing tomorrow or next week to empower the communities they serve through data?
Yeah, I'm gonna say this, y'all need to hold the line. One of the reasons that I come to ITUP, among many, is all of you in this room. And I've been watching all of your faces this whole panel. This room is made up of billions of dollars of foundation money, of health plan money, of some of the most powerful CBOs in California moving healthcare policy. It's an incredible room of individuals that I'm happy to be in the room with you. And we are influential and we have to hold the line. I was in a panel earlier with Camille Chavez, who put a call to action, and I'm gonna put it in this room too. We have to come together as allies. We're gonna have to work together, we're gonna have to hold the line. We cannot voluntarily comply. I sit on a number of boards, you can read my bio to figure out which ones they are, where we're talking about, oh, how should we change language? You know, what about this attack on DEI? What should we tweak a little bit? How can we protect ourselves from this? There are rules to get a community to comply, and if you can get them to voluntarily comply, if you can get half the room to voluntarily comply, you're already winning. So we must not voluntarily comply. We cannot policy our way out of this. We're up against a big government, but we're a big government here too. We make up a lot of people in this room too. And so I think to be an ally in this room is to look at who's not at the table with you. Is there a chair open? Bring another chair. And if that's not another chair, then you have to be that ally for the LGBT community. You have to be that ally for tribal communities. You have to be the ally that you're uncomfortable about, that you might not know enough about. And that's really my call to you all is to hold the line and continue to move the line forward.
Great. Do any of you want to give a remark before we close out or go to the audience for a question?
Maybe I'll just add recognizing our privilege, right? Just really owning that, recognizing our sphere of influence and how we can affect change even within our own organizations. So looking back at the work that you all are doing, look at your data systems. Is there a way to do some of that data disaggregation without a policy vehicle, right? Are there ways that you can start being more intentional to serve your patient pool, to recognize how many patients are indigenous or how many other folks speak different languages and serve them in that language? Think about diversity in your rooms, right? From the boardroom to your executives to the folks on your teams. Are we all represented in those rooms? Are you hiring intentionally to make sure that we're all represented and that folks from community with that experience are speaking in and up in those meetings, that our information and our stories are being told from our perspective in those reports? Are the authors also coming from our communities? So just dig a little deeper, right? I think we all have a good heart here and we want to do things the right way, but there are steps that we can take today to diversify that, plant the seeds today, and we'll continue to see that flourishing over the years to come.
Thank you. What a great way to end this panel. But I want to make sure that we at least can take one question. I can't see anything, but I'm assuming you're out there. Yeah. And if you could start with your name and organization, that would
Yeah,
be great.
sure. Ron Klinger from Partnership Health Plan, a managed care plan in California. So it's kind of something, bouncing off something you said earlier in this panel, Mr. Delgado, about finding out that we weren't using information that we had. It would be even worse if we found out we didn't have the data, right? So given that we may not be able to rely on our federal government anymore for sources of this, there's lots of data out there among our healthcare organizations and such. Have we started to think about how to build back the databases so that when we come up with a use, we actually have something there to hang our hat on?
Yeah, exactly. Yeah, when I think about SOGI data, I know a lot of people use a 10% mark, right? And it's probably from an old study that is so irrelevant at this point, but people see that as a marker, right? And to your point, if we are collecting it, well, first we should ask why. And secondly, being intentional on bringing it up, making sure that it's consistently and correctly documented, and that the data governance is there to be able to make insights. I could say, having worked at San Mateo County, it was interesting. We did not collect this information, and we were between two metropolitan areas, San Francisco and San Jose, Santa Clara County. And what was interesting to me is that people who identified as transgender did not come to San Mateo. They would go to San Francisco or they'd go to Santa Clara. And same when we wanted to look at the GLBT population when we were doing infectious diseases, we found that there was no there, right? So in the San Francisco, they have the Castro that has a concentration of the population. San Jose also has a pocket, a place that people congregate, but San Mateo had nothing. And so that's when we thought, okay, let's use apps like Grindr and go on there and educate people of what services are available to them and meet them where they are. Even if there's not a there, let's create one. So thank you for your question. And please join me in thanking the panel. I love data. Yeah. Yes. And so we're reaching the end of the conference. You know, this is the time where I give all the thanks to everyone who made this possible. And I want to start off with my team. And I'm hoping they're here, but they have been incredible. I could not have been on this journey without them. Each of them I've gotten to know. I see pictures of their families, and I'm just moved by their commitment and their values to this work. And of course, there's hard days, right? We all have them. And I try to be as flexible as possible. But what I can say is it is like a dream to have this team. And I am so grateful for each and every one of them. And earlier, we saw the board of directors, my bosses. So you all better clap because they're here, they're watching. Yeah, but you know, they've given me the flexibility to take ITUP to a different place, that we can have these conversations and feel safe, and creating this tent to meet the moment. And you know, for me, like I said earlier, as a brain cancer survivor, it really helped me focus my purpose. I no longer do work for my resume. I think about it more like doing my work for my eulogy and what I want to be remembered for and what I changed in this world. So when I see the young people that are here, that are investing their time, it gives me hope. It gives me hope. And I see the potential of what we can become and why they're so critical, whether it's voting for the first time, encouraging their other students to vote for the first time, or, like we talked about earlier, getting your family together, walking through the propositions because they're confusing. And even when you translate them into Spanish, sometimes no means yes, yes means no, and it's confusing on purpose. And so, I want to say that we all need to step up in that way. Our AV team today was fantastic, and so thank you to all of you that have been working in the background, and also the workers here at the conference center. Thank you for feeding us. Thank you for making this process as easy as possible. We see you. We thank you. Yes. And lastly, I have to thank all of you. Uh, this conference wouldn't be a conference without you. And throughout the year, people reach out and they say, "I would want to hear this," or through our regional health equity collaborative, some topics come up, and we're like, "Oh, that would be great." And we source people from those health equity collaboratives to come in and present because they are the leader in that space. So I hope that you found a home today here, and I hope you made some connections that will go way beyond this conference. And I hope we continue getting into good trouble together. Now what a lot of you are really waiting for is who won the Apple Watch. I get it. I get it. Let me see. Now I feel like Oprah. Yeah, I'm like, you get a watch. You get a watch. Okay, so of course the person has to be present. So I have a list of the top 5. Ooh, I actually know this person. I hope I don't get in trouble. David Levine, are you here? I can't see. Oh yeah, come on up. And he's a CLI alum. So great to see you. Yeah, you don't have to give a speech. Congratulations. Yeah, of course. Again, thank you everyone for being here. Thank you to the ITUP team. I think they're in the back. I can't see with these UFO lights in my face, but I love you guys. Thank you for everything that you do. And yeah, please safe travels home. And thank you again.